Artificial Intelligence Dr. www.abcpharma.net/English. User question: why the dimensions of a QRS complex in an ECG do not show any variations after implanting a unicameral leadless pacemaker? Claude AI answer: the dimensions of a QRS complex in an ECG may not show significant variations after implanting a unicameral leadless pacemaker due to the specific characteristics of this type of pacemaker and its impact on cardiac conduction. Here's a detailed explanation. 1. Pacing site. Unicameral leadless pacemakers are typically implanted in the right ventricle, usually in the apical or septal region. The pacing site directly influences the activation sequence and the resulting QRS morphology on the ECG. When the pacing site remains consistent, as is the case with a properly positioned and stable leadless pacemaker, the QRS complex dimensions are likely to remain unchanged. 2. Pacing mode. Unicameral leadless pacemakers operate in a single-chamber mode, usually VVI, ventricle paced, ventricle sensed, inhibit response, or VVT, ventricle paced, ventricle sensed, triggered response. In these modes, the pacemaker only senses and paces the ventricle, without any atrial sensing or pacing. The absence of atrial pacing and the consistent ventricular pacing site contribute to the stability of the QRS complex dimensions on the ECG. 3. Absence of lead-related issues. Conventional pacemakers with transvenous leads can be subject to lead-related issues, such as lead dislodgement, fracture, or insulation breach, which can affect the pacing site and the resulting QRS morphology. Leadless pacemakers eliminate these lead-related issues, ensuring a more consistent and stable pacing performance. The absence of lead-related complications helps maintain the stability of the QRS complex dimensions over time. 4. Programmed pacing parameters. The pacing parameters, such as pacing amplitude, pulse width, and pacing mode, are programmed during the implantation of the leadless pacemaker. These parameters are selected to ensure reliable and consistent pacing while minimizing unnecessary ventricular pacing. Consistent pacing parameters contribute to the stability of the QRS complex dimensions on the ECG. 5. Limited impact on ventricular conduction. Unicameral leadless pacemakers, by design, have a limited impact on the native ventricular conduction system. The pacemaker primarily affects the activation sequence in the immediate vicinity of the pacing site, without significantly altering the global ventricular activation pattern. The limited impact on ventricular conduction helps maintain the stability of the QRS complex dimensions, as long as the underlying conduction system remains intact. It's important to note that while the QRS complex dimensions may not show significant variations in most cases after implanting a unicameral leadless pacemaker, there can be exceptions. Factors such as pacemaker malfunction, significant changes in the patient's underlying conduction system, or the development of new cardiac conditions can still affect the QRS morphology. Therefore, regular follow-up and monitoring of the pacemaker function and the patient's clinical status remain essential. In summary, the stability of the QRS complex dimensions after implanting a unicameral leadless pacemaker can be attributed to the consistent pacing site, the single-chamber pacing mode, the absence of lead-related issues, the programmed pacing parameters, and the limited impact on ventricular conduction. This stability is an important factor in ensuring reliable pacemaker performance and facilitating the long-term follow-up of patients with leadless pacemakers.